Anderson, who you've heard speak before. So we welcome him this evening to speak to us. Thank you, Dr. Powell.
Thanks. Hi, how is everybody tonight? Good deal. It's so weird to see it get dark so early. I have trouble getting used to it. I feel like, I get to work, it's dark. I get home, it's dark. And yesterday I had the greatest thing happen. I got a little time to go eat lunch with my son, my 9-year-old. And as I'm out driving home talking to my wife, I'm like, there's this glowing, warm orb in the sky. I don't know what this is. She goes, it's called the sun. I said, I miss it. I absolutely miss it.
Son go to school?
He's at Florence Elementary.
Oh, okay, because
Yeah.
I have a grandson that's
Cool. What grade she in?
third.
Third. So is he. Now, don't ask me what class he's in, because I'm a bad dad.
But no, the reason why I asked is because
What's her name?
Yeah, BCI. Yeah.
What's her name? You're the third grader.
Val Carsdale.
Okay, I'm going to ask him. All right. So anyway, I absolutely love doing talks and getting into it. My lectures, every time I talk, they're very informal. If you guys have questions, if you want to stop, if you want to diverge from the topic, I am completely okay with that because I love to talk and I love to teach. Everybody in my family is a teacher except for me. I was the only one that decided to break free, and I spent most of my career at teaching hospitals before I left the Navy, 12 years ago. I'd been in for 16 years. I would have been in for 28 if I would have stayed in today. Wow, craziness. But anyway, what Judy had asked me to talk about today was hair loss. And I'm going to apply this to a lot of different aspects because a lot of people deal with it. And, it's interesting. I've been doing hair transplantation for almost 15 years now. I started off when I was still in the Navy. That's what I would do to moonlight because the Navy sure didn't pay us real well. So we made ends meet any way we could. I was living in New Orleans at the time, and a lot of us would moonlight in the emergency rooms. And let me tell you, moonlighting in emergency rooms in New Orleans is a whole different world. Yeah. I was aging quickly, and so.
I lived in Bogalusa. Did you ever go out to the?
I was never in Bogalusa. Oh, but I remember the smell. We would drive by it. Absolutely, the Bogalusa paper mill. But anyway, so I learned hair transplantation from a dermatologist that was there, and that's what I would do for fun and make some extra money. But it was really interesting because I've seen a real transition over the years as I got more and more cosmetic medicine, doing body cosmetic procedures and everything. I noticed things were changing, that more and more women were coming to me about their hair problems. And there's such a big difference when you look at what happens between men and women with hair loss. Men, we shave our heads. We cut it short. It's acceptable. But women, it's devastating for them. Before we get into the lecture, though, I definitely want to go through and on the side, and it is now on. Thank you. There we go. So definitely want to say thank you to the sponsors that always sponsor these things for us. We really appreciate them bringing this to you. And like I said tonight, what's happening to my hair? And we're going to talk about different causes of hair loss. Back to my female patients when they would come in, it's interesting. Whenever a man would come to me to talk about hair transplantation, from time of consultation to time of surgery, how long would y'all think that would be on average? Just wild guess.
2 days. 1 day.
2 years.
2 years.
2 years.
My son had that done. I went with him where he had that thing done.
We're going to talk about that. That's a technique I used to do. So 2 years for men to make that decision because we tend to go in, we tend to ask questions about it, we want to know about it, but then something else gets in the way. Life gets in the way. And then it keeps on coming up, and finally one day they just pull the trigger. I'm finally going to call Dr. Powell up. We're going to get this done. Women, it's 2 minutes because, honestly, they're trying to swipe the credit card on the way out, and I'm having to bat them down going, no. This is an emotional response for women, and we don't want that. We want things done because of the right thing. And there are a lot of other things other than transplantation that can be done for the hair. But before we get into that, I wanted to spend some time in just some of the basics of hair loss. For example, hair loss, which is in the medical term is alopecia, it affects both men and women. There's a variety of causes. We'll go through some of them. Definitely has a substantial emotional impact, and I do think that's stronger for women than men, but I can tell you just as many men that I could tell you some stories on over the years. I had one guy that came to see me, had a bald spot in the back, maybe about that big around, and very nice looking gentleman, very, very well spoken, but had not been to church in 5 years. And I said, wait a minute, how does this have to do with your hair loss? He goes, I'm so self-conscious about it, I don't want anybody behind me seeing it. And I'm like, I don't think I could get away with that excuse for not going to church, but my wife would hang me up for that one. But he wouldn't even go to the movies. He would wear a baseball hat to the movies, but he couldn't wear it to church. And so it really did bug him. There are both medical and surgical options available for hair loss. But one thing I do with all my patients is always come up with a realistic treatment plan. We're not growing more hair. We're taking hair that they have in a lot of cases and just rearranging it. You know, I tell them, I get guys that come in all the time and pull out that picture from, their senior high school pictures and with their big mullet cut and, saying, I want to be this guy again. I'm like, yeah, you really don't, but I'm not going to be able to do that. There's limited things that we can do. Lots of different causes for hair loss. Trauma is one of them. In fact, there's a type of hair loss called traction alopecia, where a lot of people that wear especially tight braids, the hair follicles actually get removed. Similar kinds of hair loss can be seen in women that overpluck their eyebrows. Obviously, some women would love if their eyebrows didn't grow back, but some will overpluck them and they will not grow back in certain areas. In fact, probably the third most common procedure I do are eyebrow transplants, which is really interesting because when we do eyebrow transplants, we take them from the same area that we would do a hair transplant. And we have to remember that hair is going to maintain the same characteristic and quality. So I make them swear if by some reason they ever go into a coma, they have their best friend come and trim up their eyebrows every couple of weeks because otherwise they're going to grow down to here. Yeah. It's really interesting. In fact, probably one of the best stories I've got in hair transplant, and I did not take this case, but I was so tempted. This gentleman came in, and in the Navy you can expect that, there lots of our patrons had lots of body artwork, lots of tattoos over the years. And this one guy had a horse tattooed on his back, and he wanted me to implant the mane. And I said, oh no, I can't do that. Louisiana Medical Board even wouldn't allow me to do that. So I thought it was interesting though. But anyway, the hair will maintain the same characteristic as where you take it from. And that's kind of an important concept of how a hair transplant works. Burns, another common cause of hair loss. Another one in one of my cases I can think of really well, a kid was 3 years old, went up to a boiling pot of water on the stove, grabbed it, pulled it, spilled on his head. Of course, the parents felt so incredibly guilty about it because they didn't feel like they were watching him well enough, and the burn caused him to lose the hair on his head.
Forever?
Forever. It permanently destroyed those follicles. And we have had some other burn victims over the years, but this guy probably touched me the most because he was about 12 years old when I met him, and always looked down at the ground, when you talk to him, and just.
And I'm sure he was bullied.
Probably so, but he was into sports. He just didn't have much self-confidence. It broke my heart. And hair transplantation is considered cosmetic by insurances, so typically isn't covered. However, I asked Blue Cross Blue Shield as insurance if they would cover this one because it was a medical condition, the burn that he had. They basically, offered pennies on the dollar to cover it, and I wound up doing it for free. It was one of the best things that I ever did because about a year and a half later, as that hair was growing in, his confidence level, you saw him looking up when you talked to him now, and it was something neat to do.
But where did you take the hair from to put it on?
So he didn't lose it all over. So basically he had just an irregular shape on the top of his head of hair that just wasn't there, and the skin was thickened. And that was the challenge in his case because, burn victims get thick skin afterwards. I had to actually use some laser technology to get good blood flow to the bed of the skin to allow the transplant to occur. So it was a wonderful challenge. I enjoyed it. And
so now does he have a good head of hair?
He has a good head of hair. There's limitations though, because let's say that was the density of hair that he had before. That's probably going to be the density of hair after transplant. We're never going to get it back as dense as it was because there's just not enough hair to move around. But we use arts of illusion to make it look as thick as it should be. But I saw him, last year, and that was been about 4 years since I did his transplant, and it just looks great. It's just neat to see it. But skin cancers can be another reason for hair loss. Autoimmune disorders, there's a disorder called alopecia areata, where your body develops antibodies to your hair follicles. and it attacks your hair follicles. These people you can see with just a patch or a circle loss of hair on their head, which can also be from a fungal infection, but usually when you see these round patches of hair loss, it's that autoimmune type of hair loss. And again, a very tough one to treat. There's some cases of alopecia areata totalis where basically it attacks every hair follicle of their body. These people have no hair anywhere on their body. And they're very tough cases, but there's some newer agents being treated for that are really pretty cool.
Aren't they usually albinos? I read that
We
before.
see it a little bit higher, but actually the majority of cases I see are not. The albino gene does have a higher tendency for it, but there's usually no predictor at all in these people that have it. We still don't fully understand what causes a lot of autoimmune diseases. We'll probably learn those triggers in time. Chemotherapy, everybody's seen it. Somebody that's gone through cancer treatment, has lost their hair. What's that?
Some have done it.
Some have done it, yeah. The reason why you lose the hair during chemotherapy is because chemotherapy, and radiation therapy as well, is targeted towards rapidly dividing cells. So cancer cells are usually rapidly dividing cells, growing masses. So chemotherapy is there to stop rapidly dividing cells. Well, the two most rapidly dividing cells in your body are hair follicles and bone marrow. And that's why a lot of people on chemotherapy, they knock out their blood counts and stuff because it's targeted at those rapidly dividing cells. But the nice thing is about chemotherapy, the hair will come back. You usually don't totally kill the hair follicle. One of my best friends, unfortunately, I found a lung cancer in about 5 years ago, and I found it 2 months after his hair transplant. He was so proud of his hair transplant. And then I diagnosed the lung cancer, and he went through surgery and chemotherapy, lost all of his hair. He goes, I went through all of that for nothing? I said, give it time. Now he's cured. His hair is growing in like never before. He's happy. So, yeah, and it changed. It got a little bit curlier afterwards. Other skin conditions like psoriasis, seborrheic dermatitis, lichen planus, there's a few others out there that skin conditions go. Anytime I'm looking at it, I always look at the quality of the skin. But the most common thing that we're going to see is androgenic alopecia, which is male pattern baldness. Now, it's a little bit unfair to call it male pattern baldness. It is usually seen in men, but women can develop male pattern baldness as well. We've seen plenty of women that have the recessions in the hairline that come back, or just general thinning, and even sometimes bald spots in the back. And again, it's really devastating for them. So we're going to talk about androgenic alopecia probably a little bit more, since it's the more common type of hair loss that you're going to see. There's distinct areas of the head that are usually involved, and it's usually going to be anywhere on the top of the dome, including back to the vertex. Now, there's different patterns and different types, but it never really goes beyond this area. The reason why is that this area of hair from side to side all the way across the back is resistant to something called dihydrotestosterone, or DHT. As we get older, especially in our mid-20s, we start building up more and more DHT. It's converted from testosterone, and that DHT affects some hair follicles, but not all of them. And it affects some different from others. For example, the hair that's in this region, over time, the DHT kills that hair follicle. That hair comes in thinner and thinner and thinner, and eventually just doesn't come back at all. But that same DHT goes to other hair follicles in the body and turns them from this into this. And any guy that's been to the barber and starts to have to get the hair trimmed from your ears and everything else, understand that that same DHT can make hair grow thicker in other areas. So the hair that's in this area is resistant, like I said, to DHT, and that's why we use it for transplantation. So we take the hair from this area, move it into this area, because it maintains the same characteristics. Now, there's other factors that are involved with hair loss. There's even environmental factors and various other things. But for the most part, we consider it hormonal and related to dihydrotestosterone.
So it's not hereditary like they say?
There is a hereditary nature to it, because not everybody inherit the hair follicles that are going to be susceptible to DHT. But there's no predictable level. We used to say it runs on the mother's side of the family.
Yeah,
Everybody on my
They
mom's
blame me
side.
'cause my son was bald at 34.
You tell them they can't blame you anymore. Dr. Powell said so, okay?
I
Can you
taught genetics
write
for
that
30
down
years.
for me?
Taught biology 30 years.
You know
what
it.
it is the latest is that it's dominant in males and recessive in females.
Right.
So you only need one gene. So there's no from the mom,
It's not.
crapshoot, just like all of genetics.
Exactly. And that's why females are less likely to lose their hair to
It
male
takes
pattern
two genes
baldness.
for us to be bald and only one for them.
Yep. And I still feel there's
Male pattern.
other components. Like the whole concept of dihydrotestosterone has only been over the last 20 years. And I really think that we're going to find other factors that are involved. I had a guy from India. We have a lot of clients in the Irving, Las Colinas area from India, a lot of IT-based employment there. And that's where Dr. Anderson Gammon and I work. And I've had people come over from India with almost no hair, and in a different environment, they start growing hair. They go home, they lose it again, they come back, they get it again. Probably has to do with the environment, pollution, and various other things, maybe even in their diet. Who knows? I just know there's a lot more to it than just DHT. So as far as treatment options, there's medical treatment options, which we're going to go through a few, and then there's the surgical hair restoration, which I focus a lot of my treatment on, and we'll talk about both tonight. So for medical management, most of our focus is on anti-androgens and biologic response modifiers. I'll break it down a lot more simple. Anti-androgenic just means ways to block DHT, dihydrotestosterone, the evil that we talked about. And there's lots of ways to do that. Biologic response modifiers are going to be more like your minoxidil, which is Rogaine, which is approved for men and women, by the way. So for anti-estrogens, there's a diuretic. Everybody's heard of diuretics, and spironolactone is one of them. But it's got an interesting factor in the body. It helps with potassium metabolism and holding on to it. But more importantly, it helps as an anti-androgen. In fact, we use spironolactone in some women that have acne problems because it helps block the testosterone effect of causing some of the acne issues. Cimetidine is an interesting one. Y'all probably know cimetidine. Zantac. It's Zantac. So it has some hair loss properties as well. Estrogen, progesterone. A big one is Propecia. Now, Propecia, a lot of people have heard of. Its generic name is finasteride, and it's really interesting how Propecia works. Propecia was originally designed, in fact, let me tell you this, nothing we currently use medically for hair was designed for hair. We just happened to see it was a neat side effect of some other drug we were using, and we started using it. And these companies just made hundreds of millions of dollars off of them. Finasteride was one of them. It is a enlarged prostate medication. And what it does, finasteride slows the conversion of testosterone turning into dihydrotestosterone. There's an enzyme that makes that conversion from one to the other, and it inhibits that enzyme called 5-alpha reductase. So it actually stops that conversion and slows it down in most of the body. It doesn't completely stop it. But by doing that, you reduce your DHT levels, and then hair started growing. So they noticed a lot of their patients in their prostate studies started growing hair again. They're like, cool. It's a lot like the story with Viagra and pulmonary hypertension. They figured out really quick there was another use for it, and the other one got pushed to the side. But a lot of things we use in medicine were just discovered incidentally. Cimetidine, like I said, is Zantac. There's an antifungal shampoo called ketoconazole, which blocks DHT at the receptor. And so we've got a lot of things that we can use medically. And what I've found in my career, because I get a lot of clients that come in, especially younger gentlemen, that they're not old enough for hair transplant. I have to look at those guys and say, I have to assume you're going to lose it all but a 1-inch stripe of hair around your head.
How was the youngest guy you've ever done?
Well, it would have been the burn
Oh,
victim.
yeah.
But as far as androgenic hair loss, I did a 25-year-old, and my mentor probably rolled in his grave when I did it. And I'll explain why I did it.
My son was probably 29 when he had it done.
Was he? Well, the guy that taught me, Dr. Pescara, before he passed, said, I don't consult anybody less than age 35 for a hair transplant. And the reason being is because how goofy is it going to look to have, well, the scar is one thing, but we've got technology to get away from the scar now. But let's say we've got a gentleman whose hair has receded back, we'll say this is the nose, his hair is receded back to here, and I come through here and I transplant all of this to give him hair back. Well, you have to assume that's going to go away. So can you imagine how bad it's going to look someday to have an island of hair right in the middle of the head? It happens. And that's what Dr. Pescara always warned me about. If you take them as too young of a patient, you may not have enough hair to keep it looking good for the long term. But I had this...
I take that back. I think he was 25 because no
Yeah.
doctors around here did it. We had to go to Houston. And
It-
it was so painful. And
Yeah.
that scar today, I mean, you can really see it.
Wait till you see what we're doing now. I'll show you tonight. It's got some really cool things that we're doing that get away from that scar altogether. In fact, I've had it done. This is all transplant. There, I spoiled it. So the whole process, so this one 25-year-old kid came in to see me, and he normally wouldn't have even booked an appointment. My staff messed up on his birth date and wrote down the wrong number. He was there, I was there, why not? You know, let's teach the kids something, because we could always do something medical for him, right? And what I find with medical hair restoration is combined products. It's like fighting a war. You don't roll in with just your infantry, you're rolling with your infantry, your tanks, your cavalry, your planes, your ships. The more angles of attack you have at male pattern baldness, the more success you're going to have. So anyway, I figured I can at least talk to him about that. I'll give him a free consult, give him some free advice, we'll be good. But he said he'd already done all this. This guy had researched everything and done most of it, even laser hair therapy, which is a new technology. It's pretty neat. They got lasers to remove it, they got lasers to grow it. But he really struck a nerve when I explained why I shouldn't do the transplant. And he said, Dr. Powell, I'm 25. I'm single. I'm in grad school. I haven't had a girlfriend in 2 years. My self-confidence is 0. I have the greatest selection of women right around me right now in school, and I'm scared to talk to any of them. And he goes, I don't care if I look like this when I'm 55 and have 3 kids and they're older and they're going to school. I'll shave my head at that point. Can you make me look good now? And you know what? I shook his hand. I went home. I said, I'm sorry. It's just the way I was taught. And I went home and I thought hard about it that night. And I prayed about it. I said, you know what? There's something good here. There's something special here. And I called him back the next day and I took his case. And he did great. And so I did make him sign an extra waiver that said, please understand, you may not be able to maintain this long term. Because, you know, I haven't seen him in a couple years. I need to follow up with him. I need a good finish to that story, don't I? I know his hair did great, but again, I can tell you, just like most people that we do, their self-confidence, you can see the improvement. It's really neat over time. But I even made him sign a waiver that said, I understand that someday I may have an island of hair. And I said, but who knows? At that point, maybe we have even better technology to help you out. Because again, we're not growing new hair in transplant. We're just moving around hair that they have. Rogaine was probably one of the most popular things to hit the market. And I'll tell you, I think Upjohn, which is the company that came up with it, really messed up. Remember I told you, most of these products were for something else, and they found out it grew hair. Story behind Rogaine is pretty neat. Minoxidil, which is the active ingredient, has been used as a blood pressure medication for years, but had a lot of side effects. But because of the way that it works as a biologic response modifier, they had suspicions it might help with rheumatoid arthritis. So they were using a topical form of minoxidil on the hands in a study. And they started noticing hair growing on the knuckles and everything else getting thicker. And they were like, Eureka, let's put it on the head. And it worked.
Does it really work on the head?
It does, but there's some tricks to it. Again, it works better for some than others. Upjohn won the patent for the back of the head, but they didn't get it for the other areas. Although it did work in some, it didn't work in enough that they could get the patent for it and the indication for it. So they got the indication for the back. Now what I find clinically is that if you have a bald area, it might grow some of that fine little baby type hair, but that's about it. That's about it. And here's the deal. It's like damming a river. If you dam that river to form a lake behind it, you remove that brick, you remove that dam, you're going to get a tsunami of hair loss over the next year. It's basically just stopping time, and as soon as you take your hand off that second hand, it's not only going to start ticking again, but it's going to catch up to where it would have been anyway really quick. And so a lot of guys, I think every woman in here can attest the fact that men are impatient. If guys weren't seeing results in 30, 60, 90 days, we put it away. This stuff doesn't work. But the fact is you really have to use these products for 6 to 9 months to start seeing results. And if Upjohn would have gone about their advertisements and indications differently, it would have been an even bigger product than what they had. If they would have gone more for the guys as they were losing their hair, before they lost their hair, as more of a maintenance to prevent hair loss, and said this needs to be a lifelong thing that you do, just like brushing your teeth at night, you need to put this on your scalp and go to bed, they would have had lifelong patients, a lot more of them, and men would have understood this is not a short-term thing just to grow new hair again. But they didn't have me around to advise them at the time. That's all right. But, you know,
Is that
again,
the main purpose though, Rogaine, for your hair? I forget.
correct. So Rogaine is indicated only for the hair. Now, minoxidil, the active ingredient, is also a blood pressure agent, but almost never used anymore.
What's the difference between the men's and the women's? Because I've looked at it, and it's like, you know,
The strength. It's the same molecule, it's the same vehicle or fluid that it's carried in.
one's stronger than the other.
Yes, the women's strength is at 2.5%, and the men's strength is 2.5%, but the men also have an extra strength 5%. So I've often wondered why couldn't women have the 5%, and I can't find any answer, so I usually recommend to women get the men's formula, get the 5%.
Pill, or do you rub it on?
It's a topical, so it comes in a shampoo, it comes in a foam.
Women's are more expensive, too.
Well, if they put the name Rogaine on it, it's more expensive. Yeah, you're right, they do that.
Women will pay for it.
They will, and they know it's an emotional response, but they also pay for the name. All they have to do is go on Amazon or go to Costco, and you're going to find this stuff for a fraction of the price that's generic, just like going to Walgreens and buying the Walgreens brand of aspirin versus Bayer
But
aspirin.
do you believe in generic brands? Do you think they're just as good as the one you're paying triple for?
So in the case of minoxidil, there's only 2 companies in the United States that make it. Every time you see a different brand, it's all from the same company. It's all from the same company. But when it comes to generics, let's step outside of hair for a second. Let's go to a blood pressure medicine or a thyroid medication. I have some concerns there because,
Well, I don't have a thyroid, so I go to the endocrinologist, and he said he starts people on levothyroxine on the generic, if it'll work.
right,
All power to it, but he said it doesn't always. It's again biology, it depends on the person.
depends on the person. Some people are really sensitive to it. The difference between a generic and brand name is this. Typically patents on drugs last about 13 years. In the 14th year, one company can make that generic. So what typically happens is the brand name company knows what that company is, goes ahead and buys it, and so they get to make money for one more year off of it. That's why generics are so expensive their first year out as generic. You know, you might say, wait, this went generic? Why is it still so expensive? Well, because they don't have competition in the market yet. But what's interesting about the regulations, if you have a medication that is brand name, the FDA mandates that it has to be within 1% of that. So if it's 100 milligrams strength, it can be 99 to 101 milligrams in that pill, or it doesn't qualify. For generics, that variance can be 4%. So it can be 96 to 104 milligrams and still be considered okay. But what I find more so with generics, though, is the fillers they use. They'll use different dyes, they'll use different fillers, and I've had people have some side effects or allergic reactions to those. So my thoughts are varied on them. I caution all. I'm probably the highest utilizer of generics in our practice because there's an economy to medicine, guys. It's expensive. And so, but I caution everybody, if you go to the pharmacy and your pink pill is now blue, don't worry, they probably switched to a different manufacturer of the same generic. But if you start having weird side effects, let me know, or if your blood pressure isn't controlled, let me know. It may not be as
Does
effective.
anybody actually know how many different medications there are? You know, I mean,
Like
prescription
total in the country?
Yeah.
Because it'd be different in the country versus, oh God, it's called the physician desk reference. She's absolutely right. And that book gets thicker and thicker every year.
But how can they, you know, I've lived in nursing homes for 10 years with different people, and
Uh-huh.
I saw how they just push all those pills to all those people, and it's so sad.
It is.
Because most of the prescriptions I don't even think work, to be honest with you.
Well, you know, one of my favorite things, I had a professor, how many of you guys, well, I'm sure I all remember Marcus Welby, MD, right?
Oh, yeah.
I grew up watching Dr. Welby when I was really young. I'd watch that and I'd watch MASH. And in fact, that was my controversy in life because I couldn't decide if I wanted to be a surgeon or if I wanted to be a medical doctor. I wound up doing both. And so the Navy paid us the same crappy pay whether we kept on training or not, so I just kept on training. But I had a professor in medical school, Ike Muslow, that wrote a couple textbooks that looked just like Dr. Welby. And I was enamored with the guy. And he hated technology, he hated CAT scans, he hated MRIs. He said, if you can't do it with a stethoscope and a hammer, you shouldn't be a doctor. And so his concept was this is what's so funny about him. He said, if your patients are on no more than one medication for every decade of life, you're doing a good job. I'm like, I think it should be less than that if you're doing a good job. But again, it just shows you how times change, a pill to treat a pill to treat a pill. So the answer is literally thousands and thousands to come.
I mean, you go to any pharmacy, and the line, I mean, it's crazy.
Yep, and let me tell you
Too many
something.
doctors are just, I don't know if it's a money thing or government thing or what, but, I mean, people are just pushing pills, it's unbelievable.
You know, a lot of it might be part of this. Doctors are paid on a fee for service, which means if you see more patients, you get paid more. But that model's changing, going to a fee for quality now. So they're gonna start paying for quality. If a doctor takes better care of you, they're gonna make more money, which means they're gonna spend more time with you. They're gonna use less drugs with you. They're gonna focus more on the diet and the exercise and stuff like this, where we're coming to lecture to people to learn about living healthier. That's where the focus is gonna be very soon.
But you're right though, you go to a doctor anymore and they don't even talk to you, they just get on the computer and look at your past history.
Yep.
And they don't even care.
And it's a matter of survival, and I've been on that side, and you know, you look at your schedule through the day of what you have to get through because your reimbursements are going down, your costs are going up, and the only answer is to see more. But that's what I loved about Dr. Gammon and Dr. Anderson. When I came here 12 years ago out of the Navy, I looked all over the country for places to practice, and those guys had it right. They had figured it out. It was about quality of care. It was about getting to the root of all evil, which is aging. And you know, it just had some really great concepts. But anyway, not to get too far off topic because I don't want to run over, but that kind of covers the medical side. The surgical side of hair restoration, there's different things. There is the strip method, which is what you described with the scar on the back of the head, and we'll look at that. There's what I do now called neograft or follicular unit extraction. And then some very old techniques I won't go into, I'll just say they're extremely brutal, of scalp reduction, tissue expansion, and transposition flaps. Scalp reduction, you'll probably still see some. If you're ever at church or in the mall or something, you see a gentleman with a scar down the middle of his head, he had a scalp reduction done. So what they do in scalp reduction, and I've never done one because I refuse to, they essentially cut out the baldness, pull the hair tight together, and sew it back together again. Yeah, it's pretty brutal, and there's better ways to do it now. I've seen some good results, but brutal scars as well. Now, the strip method is, as you had mentioned that your son had. Oh, I'm sorry, this is scalp reduction. So scalp reduction, like I said, big scars, and usually don't have long results because the hair continues to recede back, and now they got this big ugly scar in the shape of a Y on their head and baldness around it too.
They don't have wrinkles.
They don't. They get a good skin. They get a good brow lift with it too. Let me tell you. All right, I got to tell you another funny story. So I was on trauma surgery in Jacksonville, Florida, at Shands Hospital, and I was on with Captain Rodney Dwyer in the Navy. He was an old guy that I loved him to death. He was mean, and I had this one guy that came in, drunk driver, killed the family that he hit, and you got to treat him like you would anybody else, right? He's a human being. People make mistakes. You got to treat him with respect. And I told the gentleman as I came around, because no one wanted to touch this guy, you know, because we saw the family that came in. And he, in the rollover, had a area of his scalp missing from the rollover. And Dr. Dwyer told me, Charlie, you got a hole, fix it. And so I remember I came around, my intern was with me, and I said, all right, have you ever closed a wound like this before? Because I said, he really needs a skin graft. Dwyer said, no, fix him so we can go to jail. So all right, I'll do it. So I came around, I set everything up, I told my intern, I said, now numb this up with the local anesthesia. I'm gonna make my rounds around the trauma unit, I'll be right back. It was a busy Friday night. As I came around, the tray's there, the guy's passed out, and I'm like, sir, did my intern come take care of you? Yeah, and he called me a few choice words. And I said, all right, so I got these clips to bring the skin together. My intern had not numbed him up.
Paid for that.
And there was a little part inside of me deep down that said, oh, that felt good. But I didn't say that out loud, did I? Well, exactly. But, you know, we got him through it. But the funny part I was going to tell you was Dr. Dwyer would not let me send him to plastics for a skin graft. He wanted that guy out of there and to go to jail. And I understand. So I did it. I took a hole that big on the scalp. I reduced it down. I guess I have done a scalp reduction now that you think about it, you know. It's just back in trauma surgery days. And as I closed it up, everybody was like, oh, that's awesome, good work. And I pulled the drape back and one eye is completely up about like this. I felt so bad about that, but Dr. Dwyer said,
You redid it, right?
I did, yeah. I said, well, he can get the other side done later. But all right, I'm getting too far off. Now, strip method.
That was a good story.
It was a great story. It's one of my favorites. The strip method, again, when we're looking at hair transplant, we're taking the back of the scalp, and we're taking hair from that area and moving it to the top of the scalp in areas that have been lost. When I had mine done 6 years ago, I'd pretty much lost everything up here except a little tuft of hair right through here. My pictures are hilarious. Judy and Walter and Mark have, remember me from those days. But the strip method is what I originally learned. And literally what you do in strip, you come to the back of the head and, see if I can draw this a little bit better. On the back of the head, that's a flat head, but I ran out of room. We basically cut out a section of scalp, almost like a smiley face. That's the back of the head, not the front. We remove that section of scalp, and then we sew this back together. And that's the linear scar that you see on the back. That section of scalp that's removed under microscope then is then divided into separate individual hair follicles. And then we take those follicles, we make tiny incisions on the scalp, and like putting a noodle through a keyhole, we put these things in, thousands of them at a time, to transplant. That's the concept behind strip.
The person awake or asleep?
Well, they're awake.
They're awake.
They're awake. It's all done with local anesthesia, lidocaine, like you get at the dentist. I typically will use a little sedation to make them groggy and happy, but I don't do this anymore because the big joke in New Orleans was, what's a bald guy doing hair transplants? I felt like the biggest hypocrite in the world. But the fact was, I was still active duty in the Navy. I'd been in for 16 years at that point. I wore my hair in a height and tight, and having a big smiley face scar on the back of my head was not an option. And it just didn't mean that much to me. I was okay shaving my head. So anyway, as newer technologies came out, which what I do now to get rid of that big scar, I finally said, now it's time. Let's do this. So anyway, great method. In fact, Bosley Clinic and all those clinics still use this method now, but it's just not for me. And so I finally decided if I'm not willing to have it myself, I'm not going to do it. And I focused on follicular unit extraction. This is an example of the scar that's left after the strip method. And you've probably seen this on your son's head. I mean, you can never wear a short haircut again. Done. Yeah. In fact, I've had lots of guys come in with this and said, my top's fine. Can you transplant my scar? Can you put hair back into the scar? And I've got some techniques that do it. I've got some guys that we even use medical tattooing to tattoo dots into the scar so it's not so evident too, so they can wear their hair short again. But then they turn gray and they got this nice little black dots across the back of the head. Now, what I do is follicular unit extraction, FUE, and I use a device called NeoGraft. It kind of automates it. But this is so much better in my mind because instead of removing a section of someone's scalp, we're removing one hair follicle at a time. Now, don't confuse this with back in the 80s, those hair plugs that looked like doll's hair all over the head, like cornrows. No, this is not it. In fact, you can look at mine and see that. It's one tiny hair at a time. It's so tedious. It takes so long, but the results are so worth it. So we spend a lot of time with this technique. NeoGraft made a machine that kind of automates it, makes it a little bit faster, and some companies even come up with robots out there for the extraction. I don't use those. I like humans better. But basically, we're removing one follicle at a time. Now, in the diagram up here, you can see something kind of neat. You can see that what they're removing looks like it's 2 hair follicles, but it's 1. The actual hair follicles can grow 1, 2, 3, or even 4 hairs out of one follicle. And so we don't select, we take any of those. We say, hey, you know what? We'll put the singles on more towards the front. That's why you see a soft graduation into mine going back and getting thicker. And then we'll use the 4s more towards the back as filler to give it a full appearance. So we've got a place for all of them. We divide them up, we put them where they need to go. Now, the difference here is that since I'm not removing a section of the scalp, I have to prepare every man or woman that has this done. I've got to shave the donor area. And for a guy with my hair length, not a big deal. Shave it, it looks goofy for a little while, I blend it in. You tell a woman with hair down to her shoulders you're going to shave her head, that doesn't go too well. So with women, I've learned concealment techniques where we shave little areas and we let their hair kind of cover that up. And there's lots of neat ways to get around it. But follicular unit extraction, this is at day of surgery. You can actually see the tiny little dots are where each individual hair has been removed. What's nice is you look at that and you're like, oh great, so now my donor site's going to look moth-eaten. I have now had 2 hair transplants to fix what I have up here. Average hair transplant is 1,500 to 2,000 grafts. I've now had 3,500 grafts done to fix this thing up here, okay, to make this mop grow again. And I challenge anybody, do you see anything missing? We never take enough hair to make it look thin. As long as we don't take more than 40–50% of the density, the human eye can't tell the difference. Now, in this, well, that's one of my before and afters. I've got some pictures that actually show it. In fact, this guy here, you can see, had strip done before, and obviously wasn't going back to it again. A lot of our patients have had strip already and wind up in my clinic because they're looking for alternatives. But anyway, as the hair grows out, they can wear their hair that long again, and you're not even going to really notice that the hair's missing. Now, this is actually, I have a ton of before and afters on our website if y'all ever wanted to look at them. But this one is a guy I really wanted to do a good job on because he's an attorney. I tend to work harder on those guys. I don't want to mess with any problems. But no, we work just as hard on everybody. Now, this guy was stage 1. He was going to need 2 stages, and we knew it up front it would take more than 1 transplant. That's a lot of area to cover. Each bump that you see is a transplant. That's 1 follicle placed into place. So when he grew his hair out, we knew stage 2 we'd have to thicken it up a little bit more. So that's after stage 1. You can see towards the front there's still a little bit of thinness. You can see a little bit of scalp there. So on stage 2 at the end of year 1, I came back and put some more hair in there for him. Haven't seen him in 2 years. So I take that as a happy client if they're not back in my office. So.
But did you get, on the after picture, did you get it from the before picture?
Mm-hmm. Yep. And so we got it from all angles, we've got it from all sides, and this guy looked good all around. I just didn't want to flood it with it. I'll tell you, so our website, if y'all are ever interested in looking at some of those photos, we've got some really good ones. The website is smartnewyou.com. That's the name of our clinic within Healthcare Associates, Smart New You. And it's more of a department really within Healthcare Associates.
Any periods in there?
Just one word, smartnewyou.com. And there's some really cool before and afters in there. You'll see a ton of stuff that we do in the cosmetic area and a new sleep apnea procedure we're doing. I guess I'm talking about that in April. But
Oh, that'd be a good one.
it's a really cool procedure.
Oh, you work with that too?
Mm-hmm.
Oh.
See, like I told you,
Have problems
I
with that
couldn't
too.
decide what I wanted to do in
They
life.
wear- They wear those masks and everything.
This
It's
gets rid of
awful.
those masks and it takes 5 minutes. April.
really?
I got to wait till April. Judy will kill me. So that's kind of an example of before and afters. Now, with hair, we always try to take a conservative approach because, again, we're trying to give these people realistic expectations. We don't want to go overboard and do too much up front. The idea of getting them a realistic opinion of what they're going to look like, everybody says, especially with today's computer technology, can you show me what it's going to look like afterwards? Worst mistake you can make, because if you show them something and you don't hit that goal, they're not going to be happy. But I always set the bar here, hit here, and everybody's happy. I tell them, well, it's going to be kind of thin, it's going to look good through here, and then when it really comes in nice, everybody's really thrilled. And I prepare everybody. It might take more than one case to do it. It may take two to really get the fill in. But anyway, realistic expectations are really important. This is a long-term commitment. I've had lots of guys come in for consultation, and I ask, the very first question I ask every man when I walk in that room is, how long have you been thinking about this? And I learned my lesson on that early in my career because after the guy consulted and everything, we were scheduling a surgery date, and I hear him mention, oh, yeah, that woman left me 2 weeks ago and I'm going to make up for it. I'm going to be back on the market. I'm like, oh, no. Emotional response. I do not take on patients that are making an emotional response. It's just, my mentor taught me you'll never make them happy. You can't make an emotional decision on something like this. So I turn it out, so now I ask how long you've been thinking about this. And I still get occasionally a guy that says, well, I'm getting married in a few months. And I tell him, this is not for you. You're still going to be bald in 3 months. Because what's going to happen is we're going to take that hair from the back or the sides. Actually, it's probably better if I do it with my pen. We're going to take that hair follicle with this little 1 millimeter stubble of hair from the back or the sides, and we're going to transplant it to the front or the top. After we do that, it puts a lot of trauma to that hair follicle. It really does not like it being messed with and being moved around. And in fact, in the first 2 weeks, the guys wake up and they see this little 1 millimeter hair on their pillow, and they're counting the dollar signs because we charge per graft. And they're thinking, oh my God, that cost me $200 last night. I calm them. No matter how many times I say it before the transplant, they still call within the first 2 weeks freaking out. And I have to tell them again, hair is not alive. Hair is a dead piece of protein. The follicle is what's alive. And in that shock of the transplant, of things being moved around, that hair follicle goes in what's called a telogen rest phase. It lets go of the hair, and it goes into that rest phase. That rest phase,
Like the root?
the root.
Yeah.
The root is the same thing as the follicle. And that rest phase is variable. It can be 3 to 6 to 9 months. So I prepare all guys. I tell them my case. Not a single hair grew on my head for 8 months. I kept shaving my head. In fact, I started getting worried. I was like, oh my gosh. About a little bit less than 0.5% of hair transplant cases fail. Even though it's their own body into their own body, their body can attack
Why
it.
did you keep on shaving it if you wanted it to grow in?
Because it wasn't growing in yet. It was
So
still,
they told you to shave it?
I kept on shaving it because
He had fuzz.
I did, right, it kind of comes up in little areas, and I didn't want it to come up looking patchy. And so I just kept shaving it. And then about month 8, it's funny, so in my late 30s, all my friends were getting married for the second time around. And so I started going to bachelor parties in Vegas again and realized I cannot be doing that. I'm getting too old for it. But I came back from one of those, and I was growing hair. I'm like, I need to go to these parties more often. I'm growing hair. But that's when I started letting my hair grow out. And here's what was so funny. As I walked through that clinic, Dr. Anderson and Dr. Gammon's clinic in Las Colinas, I was getting comments from the business staff of like, are you losing weight? Are you working out again? I'm like, I've got hair. They had forgotten. They had forgotten that I've been bald for so many years. But anyway, so it's a long process. I tell every patient it could take up to a year to really see the results, not to be impatient.
So
But
there's hope for my son if he's completely bald now, he still has follicles that you could work on it?
potentially. It just depends on how much he has left, how much needs to be done. I will tell you, I'm going to Italy in the spring. There is a new technology that's not even FDA approved yet, artificial hair transplantation. It's artificial hair with titanium base, because titanium is what most dentures are made out of and most dental implants into the bone, because your body doesn't react to titanium. And so it's a titanium base. Oh, I'm sure it is. I'm sure the hair is going to be really expensive. But it's good for up to 10 years. Now, I still don't believe it till I see it, but I'm going to go to Bologna, Italy. They get things approved a lot easier in the European Union than they do here. And so I want to be one of the first guys that knows it in case it does. So I'm going to go ahead and get my training in. But so back to your son, so if he has enough hair, yes, we can use current technology. I truly feel what we'll see in the next decade is we'll see autologous stem cells perfected, where somebody comes in, we do liposuction, we convert your fat cells contain more stem cells than even your next to only your bone marrow. And so we can take stem cells from the fat, reprogram that stem cell to become a hair cell. They've done it in mice with great success. Now, mice have about 3 different hair types, that's it. Humans have 9 to 10 different hair types, transitioning all the way down the back of the neck, the eyebrows, the eyelashes, pubic hair, everything else. They've done a human trial 4 years ago. They haven't released any pictures. I have a feeling they turned on the wrong hair type, but they haven't released any pictures. But there's some complications to, I mean, it's a very complicated technology when you're looking at messing with genetics.
I'm just curious, on the average person, how many follicles are there on top of the head?
Varies from 10,000 to 50,000 and plus. It really depends on ethnicity. Well, let me ask you this. I'll do one of the trivia prizes because I haven't given you the answer, but whoever can answer it first. So, as far as density of hair, would you think that a blonde or a redhead would have a higher density of hair? Who wants to raise your hand if you want to answer that?
Probably red.
I'd say the blonde.
The blonde has a lesser density of hair. I did say lesser, right? Or more, okay. So you would think the redheads, because they have such thick and full hair, right? But the difference is their density is less. So their hair is further apart, but the shaft width is thicker. The hair itself is thicker, so it makes it look thicker. But in actuality, the hair is spaced further apart. So Judy and the guys at Executive Medicine of Texas are giving away ultra sexy hair, skin, and nails. And looking at the components on this,
Biotin?
it has biotin's the backbone, and that's the first thing I'll look for. Biotin, folic acid, right amount of vitamin C. So this is a great product. It really is. Whoever designed this did a great job. Biotin's the great backbone. So there you go. Now watch out, it's going to make your fingernails grow like crazy too.
How about my hair?
Well, it'll make it grow faster. You know, biotin is a backbone for vitamin-based stuff is really neat. Saw palmetto can help as well. But biotin doesn't really make you grow new hair if you're bald. but it can take thin hair that you have and make it grow to a thicker stalk, and it definitely makes it grow faster. I mean, I went from, when I went on biotin, from trimming my fingernails maybe every 10 to 14 days to every 7 days. You got to trim them up because they grow a lot faster. It's interesting because hair grows on the human head on average about 6 inches a year. I thought it would be more than that. I really did. But 6 inches a year. Now it varies by ethnicity. Asians have the fastest growing hair. Just thought you might want to know. I thought that was interesting. But
Asians do?
Asians do, fastest growing hair. Now again, that's probably not solid across the board, but that's just the generality of what the studies have shown us. But I really think 6 inches a year, but you got to remember they put African Americans in the category that have very slow growing hair. So when you average it across all ethnicities, it probably comes out to about 6 inches a year.
Seems like kids here, they're getting their hair cut every couple of weeks. Do kids here grow more?
They're in more of a growth phase, and so yeah, and the kids tend to have a better lifestyle than some adults do. We tend to start poisoning our bodies.
I have a 9-year-old son. I have a 9-year-old grandson, and I get so mad at my son because they give him crew cuts all the time. It's always shaved head.
Right.
And he looks like a skeleton, but he's a good little athlete, you know. But I said, let his hair grow out. Is that bad to do that?
There's no harm in it, except that sometimes clippers, if they're taken down too close, can actually grab the follicle. If they're not sharp enough, can grab the follicle. I'm sorry, grab and remove the follicle. And so if you're just cutting the hair, that's not a big deal. But if you're taking just the hair itself, like plucking the eyebrows, that's even fine because the follicle's still there. But if you have a dull set of shears and it pulls the follicle too, that hair will never grow again. It's dead.
So once the follicle's out, it's it. It won't grow
So as
back.
long as it's good, sharpened shears and stuff like that, it shouldn't be an issue. I mean, I wore a military high and tight for 16 years, and I still had plenty of hair on the sides, just nothing on top. That was thanks to what I inherited. We're going to get down to some questions and answers here in just a second. Let me see if there's anything else I wanted to wrap up with. Well, let's just go ahead and go to questions and answers.
Do you have a card?
I do. In fact, I brought some. Judy made me promise I would. Now, I warn you, this has our old logo and name on it because about a year ago, Dr. Anderson and Gammon and I, even though we were already partners, decided to combine all of our business together. And so we renamed it to Smart New You. But the old websites still work, okay? And I'll set those out if anybody wants one of those. They're there. And we do, you'll see if y'all get on the internet at all, y'all see we do a ton of cosmetic stuff there and a lot of anti-age stuff. And Dr. Gammon and Dr. Anderson do a lot at their office here in Southlake too.
Oh, they do?
They do. They've started doing some stuff there. They'll do Botox and light stuff.
Market?
You got it. That's the one. And they'll do Botox. They got the new freezing therapy. What is it? Cool sculpting. Sorry. So, and they do the Bio-T hormones. Oh, those are awesome. I like the hormone therapy. That's one thing I have to caution men about. You know, they're like, hey, I'm on testosterone. What do I need to worry about with hair loss? It's going to accelerate it. But I said, but what means more to you, your liveliness or your head? But the nice thing is we can block that response. You know, Dr. Anderson and Gammon are very astute to this, that, you know, when you put them on the testosterone therapy, you might need to block that enzyme that converts testosterone to dihydrotestosterone, and you can mitigate that effect a little bit. Okay?
Is there something that I would take for my hair to grow more fuller?
Possible. And so I would probably, in your case, the easiest recommendation would be something like vitamins, just like what they have there. But biotin with certain other mixes will help. What I would recommend in your case, it would be the easiest without having to go to a doctor, would be something like the mix they have. It's more than just biotin. It's got the vitamin C and it's got some herbals in it to help block some of the DHT. But also I would consider minoxidil for women. But here's the deal. Most people don't give these products long enough. You've really got to give it 6 to 9 months because you got to wait on that hair to get influenced by it, then you got to wait on that hair to start growing out. It'll take some time.
I lost quite a bit of hair after open heart surgery years and years ago.
Right. That's very common.
Came back somewhat.
Right.
And I've been taking the biotin, and maybe it's not strong enough. I don't know.
On the biotin, minimum of 5,000 micrograms. I just looked at the stuff that they have executive medicine, that's 6,000. So minimum of 5,000. But years ago, my patients with hair were asking me what's good for the hair. And you know, there's biotin, there's vitamin C, there's vitamin A, a certain amounts of vitamin E, certain herbals. And I remember one guy actually went and purchased everything. And I just gave him a list. I'm like, you didn't have to, I just showed you what was good. He spent $200 buying everything that was on the list. I'm like, oh my gosh. So that's when I said, okay, there's got to be formulations, and that's where formulations like this came from. You know, the formulation here that they have at Executive Medicine of Texas is a combination of things. And remember what I said earlier, if you're going to fight this medically, you really got to come at it from different angles. So biotin alone, probably not going to be enough. Now, they have, oh, I have to hold it further and further away every year. There we go.
You want my glasses?
I'm getting to that point. The herbals that are in here also have good positive effects. You know what's interesting? Doctors that don't embrace herbal medicine are idiots, plain and simple. That's my theory. Because what they don't realize is that 80% of the medications that we prescribe were discovered in nature from herbal compounds. How many people are here on a statin for their cholesterol? Me too. I fought it for years, but I finally had to concede. Statins came from red yeast extract. Red yeast grows on rice in Asia, and that's where they found the first statin, lovastatin, that was reproduced in the lab, and then they came up with all the other statins. So you know, herbals like some of the ones that are in here have shown to help block dihydrotestosterone effect, either by stopping its conversion or blocking it at the receptor to keep it from affecting the hair follicle. Oh, certainly. We'll give it to you. Answer a question right, you might win a free one. This is actually called Ultra Sexy Hair, Skin, and Nails. Now, Judy, this is available at y'all's place?
Yes.
Okay, so talk to Judy afterwards. She'll tell you how to get some of it, because this is good quality stuff. But again, you got to have kind of combination therapy. So the biotin may not have been strong enough, and it probably didn't have the other combination of things coming into it. You said you had heart surgery and you noticed a good bit of loss after that.
And that's when I first started it.
Yep.
Some go back.
Physical and emotional stress can do it.
Yeah.
Yep.
I had a lot of stress.
That can certainly do it. And you know, a lot of times during a stressful event like a trauma, a surgery, a divorce, whatever the case is, I encourage people that give it time, because your hair is one of 3 different phases as it grows. It's an anagen phase where it's actively growing. There's a catagen phase where it's grown, but it's just stuck there. It's not going to grow anymore. And then there's a telogen phase where it falls out and that follicle just sits there and rests. At any time, about 15% of your hair is not in. It's in that rest phase. But during stress, like a hair transplant, heart surgery, emotional stress, you push that hair into a telogen phase, and it's called telogen effluvium, where you push a greater majority of the hair into that rest phase. And in doing so, I just try to encourage them, chill, let's get you on some vitamins, relax, get healthy, and a lot of times it comes back, but as you notice, sometimes it doesn't.
A doctor told me that you have to eat a lot of protein, that if you don't have enough protein, your hair will start falling out.
Hair is protein. It is protein, it's mainly keratin. Yes, ma'am.
I've got a question. Hypothyroid to begin with, and when you have hypothyroidism, you'll lose a lot of hair.
Yes, ma'am.
One doctor told me take biotin. Another one told me take Rogaine. You have to wet your head in the morning and wet your head at night. That just wasn't going to work.
No.
So I just thickened it up and it was okay. Then the doctor put me on Cymbalta. Oh my.
That's a killer.
That my hair started falling out, and as you get older, your hair thins to begin with.
Correct.
There was a time in my life when I had to have my hair thinned. I had so much hair, and it was really thick. And now I've gone the opposite way. And when I wash my hair, I see more hair on the side of the shower from my hands. And
Right.
I'm thinking, this is getting worse. So I stopped the Cymbalta. I thought, I'm not taking that anymore.
Right.
So now it's, you know,
Like
there's
that?
products that you can put in to make your hair look thicker than it is. and
Right.
They really help. But there's,
I've always
I
thought you
think
have
you have a
beautiful
lot of
thick
hair.
head.
Oh my gosh.
the top of my hair, there's just, top of my
It
head,
damaged
there's
the
just
follicles.
a few little strands of hair.
Should we be worried when we brush our hair that a lot of strands are laying in the brush? Is that bad?
No, you can lose hundreds. You can lose hundreds of hairs every day and be normal.
Hundreds? Wow.
Hundreds. I mean, you got some people have up to 100,000 hairs on their head, and so that hair can be pushed into that rest phase a little bit more, but it should come back in time. But for women, it's a long process.
There's not much
Sometimes when medications are the cause or thyroid's involved, it never comes back really well. I had a guy that came in at 1 year, his hair transplant looked awesome. And he comes back at 18 months and it's almost all gone again. I'm like, that's impossible. You don't lose transplanted hair. Once it grows in, it's permanent. And so I just racked my brain on it. Saw him back 3 months later, it was even worse. What he forgot to tell me is that his other doctor had changed one of his medications to clomiphene citrate, and it just killed all the follicles on his head. Wow. So he's off of it now. I'm hoping some of it grows back. But tell you what, we got a couple minutes left. I got 2 more bottles to give away. Let's see. First person that raises their hand and answers, what's the average length that hair grows in a year across all ethnicities?
6 inches. You just
We had somebody in the back. Who raised their hand first? Okay. So,
We all said it. It's a tie.
yeah. Y'all can split the bottle. I'm sure there's lots of capsules in here. We'll give that to you. And just because I want this to work for you, I'm going to give you the third one, okay, hon? Anyway, we just got a couple more minutes left. Does anybody have any more questions that we want to ask about hair, anything else? Heck, you got me for a little bit longer. Why not?
If my son wants to come in for a consult, is it the Irving office he goes to?
Exactly. That's the only one I do the hair transplants at right now.
Okay, and about sleep apnea though too.
That's where we do the sleep apnea surgery too. It's so cool.
Oh, you do surgery for that?
Mm-hmm. Well, you have a new surgery for it. I'll hit on it real quick since we're done with this. Judy can't get too mad at me. Yes, ma'am.
Do I need to come to you about my hair or just?
You know what I would do first? Give it 6 months of being on a product like that. As that runs low, executive medicine can make sure you can get more. And get on some minoxidil for women. But you don't have to wet your hair, and you don't have to use it twice a day.
Oh, really?
That's the key. You get the extra strength version.
And that just wasn't going to work.
What do you got?
You get the liquid stuff, okay? And when you get the liquid stuff, just I put it into a spray bottle. And I just spray about 15 times on my scalp and I brush it in. Because for me, I'm not trying to grow new hair. I'm trying to maintain what natural hair is still up there on the sides so it doesn't go down to here and then it looks really weird with a nice little hair island right on top. So
It's very thin, right up there. There's just a
just do it at nighttime. That way your hair's not greasy during the day. Do it as a nighttime routine. Takes all of 3 minutes.
Doesn't it have to touch the scalp?
It does, and that's why I use the spray bottle, and then I brush it in. I use a brush with like little rubber tips on it, and I just basically use that to massage it into the scalp. And then again, whatever's left up there will seep down into the follicles. Yes, ma'am, I think it would. Minoxidil, but I'd only use it at nighttime because I find that the liquid preparation makes the hair a little bit greasy during the day, and it's hard to style. It's part of my nighttime routine. Honestly, my bottle from Costco sits.
in the morning.
Exactly, and I wash it out in the morning, go about my way. Whatever works best for you. I know. If you wash your hair every morning, it makes it easier.
That's why I never used it.
But I keep mine right next to my toothbrush at night, and that's just part of it takes me an extra 30 seconds of my life every day.
Does it matter how many times a week you shampoo your hair?
It doesn't. Studies have looked at that. They've tried to figure out, now, obviously, if you're using caustic chemicals on your scalp, there has been some evidence that can have an effect. As long as you're using healthier shampoos, there really isn't much of an effect on that. But if you're using a lot of heavy hair products, yes, washing it more frequently can help because you're getting a lot of those caustic chemicals out instead of staying on your scalp too long, letting the scalp breathe. Yes, ma'am.
Can you revisit that product, the shampoo, ketoconazole? Is that available?
It's over the counter and by prescription. So ketoconazole is an antifungal that is typically used for dandruff. Okay, so K-E-T-O. Well, the brand name you're going to see on the shelf is called Nizoral. N-I-Z-O-R-A-L. Now that's the 1% version. The prescription strength is 2% ketoconazole, and any doctor can write for that. I have it at all the pharmacies. It's dirt cheap. But the 1% is even fine. You just have to use it a little more frequent, but it kind of dries the hair out if you use it too frequent. But what ketoconazole does is it blocks DHT as it's trying to hit the receptor on the hair follicles. So it blocks it there. Again, solo use, never overly impressed, but what I recommend for my post-transplant patients is minoxidil at night, saw palmetto, which is usually for prostate health but can help block DHT, and then ketoconazole 2 or 3 days a week in place of their regular shampoo. Let it sit on the scalp for a few minutes.
Salt palmetto capsules?
Right. That can help block that DHT as well. I don't like Propecia. I will prescribe it for men that ask for it. It's even been used in some women, but can't be used around reproductive women. But women that are out of reproductive years, you can, because it can cause really bad fetal abnormalities for pregnant women. So you can't, I mean, I even tell men, if your wife is pregnant, it's not, I don't even want it in the same room with her. But I don't like it in men. It tends to causes a lot of sexual side effects over the years, and I just, if you can avoid it, the saw palmetto is a good natural option to do it just the same.
Women can take saw palmetto too?
Yes, sir.
Yeah?
Really?
They can. So combination therapy, I think, is best.
And that would help grow hair?
The shampoo with an oral med, like a spironolactone?
Absolutely. Again, the more,
THC is all.
I know. Think about the dam in the river kind of concept. And each thing you use is another brick in that dam. Now, what you don't know is any of those bricks the vital one? Like I used to do laser hair therapy to stimulate blood flow, and it actually blocks DHT as well. And I stopped it, and I was so worried that might be the one Jenga brick that I remove, and the whole thing tumbles, and you lose all your hair. I was fortunate I didn't. But you know, you want to add as much as you can realistically do that's not a nuisance, because you're going to have to do this for the rest of your life to maintain it. It's not going to cure it. It's just going to treat it. So make sure anything you choose of combination therapy. You saw cimetidine, which is Zantac. The studies that were done were not for oral Zantac. I'm sure it doesn't hurt, but they were actually using topical preparations of Zantac that were made at compounding pharmacies. So neat stuff.
Have you ever heard of PRP?
I use PRP. I use it post-transplant. PRP is platelet-rich plasma. It's where we take a person's blood, we spin it down to platelets, we cause the platelets to release their growth hormones. So what I tell guys is, if you consider hair transplant like transplanting a bush, PRP is like putting Miracle Grow on it at the end, the fertilizer to help it grow better. So PRP can be used for hair growth, but I didn't like those studies. It's very painful injections, and the results were eh. But I do put it on right after the hair transplant, and I let it seep into the root of the follicle, and we see excellent results with that. That's one of my tricks. And in fact, it's one of my favorite things to add on as a freebie because it costs almost nothing. The technology was expensive to buy into, but it's all paid off now. But we use PRP for other cosmetic procedures. When we do CO2 facials and laser the face, we get great results with it. And it's just wonderful to use your own body as its own growth mediator. Yeah.
With that sleep apnea surgery, does insurance pay for that or not? They do?
Medicare, Medicare Advantage, commercial insurances are starting to pay for it. It is something else. And I got into it because I have sleep apnea, and I cannot tolerate a CPAP. I hated it with every fiber of my soul.
Yeah, I feel so sorry for, I mean, their wives have to watch these kids with these and kids
Yeah.
with these mats.
I would not put it on until my wife closed her eyes and went to sleep, and half the time I went to sleep before she did, and I never wore it. And
Is the surgery major?
5 minutes, drive yourself home. It's like going to the dentist.
Oh, really? Do you have to go under anesthesia?
I use local. But the key is you have to do it 5 times, about a month in between each of them. Really cool. In fact, if there's any interest in it, I believe it's on our website. You can look at the card and go there, because I wasn't supposed to talk about it tonight, but it is a,
Oh, it's under that thing?
it's in the same, it says in the same department as what those cards go to. But that thing, my gosh, I do about 25 surgeries a week right now for sleep apnea.
Wow.
They almost didn't let me come tonight because I'm so backlogged.
5 minutes?
Takes 5 minutes, but to actually do the procedure. But then there's the setup, there's the post-op.
Yeah.
You know, I tell people plan on being there an hour.
Well,
And
but those doctors are getting mad now, the ones that make the machines. and
well, it just so
do the
happens,
testing at all the hospitals.
Dr. Anderson and Dr. Gammon and I also own the company that puts out the machines, but we're just like, we don't care. We just want people treated, you know.
Boy, that's a really
I'm gonna have my sons both look at
That's a
that
good one.
tonight.
Yes, ma'am.
That's
How
awesome.
about somebody who's on warfarin? Let's say warfarin, can they have that sleep apnea surgery?
Yes, ma'am. But I like to do what's called a Lovenox bridge. What I'll do in those cases is for 4 or 5 days before, I'll stop their warfarin. I'll put them on Lovenox, stopping the night before, start their warfarin back the day after. Now, if it's for paroxysmal atrial fibrillation, here's what's neat. The #1 cause of atrial fibrillation, sleep apnea. It's just being discovered. And if you would have taken care of the sleep apnea as the root, they would have never had the AFib. So it makes me wonder, if we get rid of the AFib, do they even need to be on the warfarin for the rest of their life? That's still being studied. But, oh, well, in that case, that's different. You know, with the valve transplant, you definitely have to do a Lovenox bridge. Because in some AFib patients, I can just stop it and not do the Lovenox bridge. But when you have the artificial valve, you have to.
Lovenox bridge, what is that?
Lovenox is an injection. So warfarin will stay in your system as a blood thinner for 5 to 7 days. Lovenox is out in hours. And so you have to give yourself a shot once a day. So it acts in place of the blood thinner, and you just stop it the night before the surgery, but you start it back right after as you get back on the warfarin. Usually only done for more major surgeries, but it's so easy to do. We do it for something minor like this too. So, all right.
Well, you want to get home to your kiddos.
I do. Actually, I think I got to do some Christmas shopping, but yeah, please do. Well, thank you guys for coming tonight. If y'all have any questions, and I look forward to seeing y'all in April.
We will be here.
All right.